Mr. Speaker, I move that we recognize the Honorable Representative Linabelle Ruth Villarica from the 4th District of Bulacan for her privileged speech.
The Honorable Villarica from Bulacan is recognized for the privilege hour.
Mr. Speaker, esteemed colleagues, thank you very much for still being here. Most especially to my guests who have stayed behind to show support to my speech this evening. Thank you. Actually, this is part 2 of the privileged speech I delivered last September 19, 2022 on the topic of allocating more funds for the Cancer Assistance Fund in the proposed General Appropriations Act of 2023. At that time, the Department of Health was appealing for the inclusion of 500 million pesos for this purpose. As president of the Association of Women Legislators Foundation, I raised this issue in plenary to create a concerted action of support from among us. With the Senate acting in unison, the appeal was approved. Presently, the DOH expects the full utilization of the fund under the 2023 GAA and shall be released pending the approval of the joint memorandum circular of the DOH with DBM. This is because of the increasing demand for assistance from cancer patients. Nonetheless, for an evidence-based estimation of demand, fund utilization in 2022 was 100% obligated, 83% dispersed, but pending documentary requirements completion, it is 100%. Hence, the health agency, again, is appealing for an additional 1.3 billion pesos. This is on top of the 1 billion pesos for the Cancer Assistance Fund as provided for in the proposed GAA bill. Your Honor, this representative is strongly endorsing the appeal of the DOH to increase the CAF to a total of 2.3 billion pesos in 2024. The increase in CAF will cover the cost of both inpatient and outpatient services packages for cancer prevention, screening, early detection and diagnosis, treatment and its care-related components, thus enabling access not just for treatment support, but also other screening, early detection services, especially for high-risk individuals that will help in strategically controlling the spread of cancer in its earliest stage. This is aligned with the direction of the DOH to enhance interventions on screening and early detection services. This will benefit cancer patients, persons living with cancer, cancer survivors, and individuals high risk for cancers. To ensure equity of access, its beneficiary will be able to get support up to 150,000 pesos per year. Thus, the fund increment will benefit an additional target of at least 8,667 beneficiaries instead of only 6,000 that will be covered by the proposed 1 billion pesos Cancer Assistance Fund for 2024. A CAF of 2.3 billion pesos, therefore, is projected to care for a minimum of 14,667 beneficiaries. The DOH tells us that, in fact, existing records from them would show that current CAF beneficiaries already reach 50,450 patients. In the National Cancer Summit in February 2023, Dr. Rosario Pitarque, president of the Philippine Society of Medical Oncology, reported that cancer, already the third leading cause of death nationwide, kills at least 96 people a day. But it did not be a death sentence with early detection and increased prevention awareness. Cancer Coalition Philippines Vice President Carmen Auste identified, among others, 3 hindrances. First, the patients themselves, who immediately back away from treatment because of the cost. Second, the medical field, when even medical practitioners lack of knowledge on the signs and symptoms of cancer. And third, the government, which, among others, needs to improve its system or referral pathway from the rural health units to the hospitals. And not to mention even our lack of healthcare workers and specialists. I know this for a fact because one of our very dependable department heads at the local government of the city of Maykawayan was misdiagnosed in a private hospital there for several months until the director of our LGU's dialysis center saw her and immediately referred her to colleagues at the PGH, where she was immediately confined. But unfortunately, by that time, she was already diagnosed at stage 3. Sharing her experience is my way of honoring Juliet Conquilla Montevilla, who fought the good fight, underwent the rigors of chemotherapy as evidence of her living faith, and even went to work up to a week before she passed away with dignity. There is always a sense of urgency, Your Honor, with a big C. That is why, even as I appeal for a 1.3 billion pesos increase for the Cancer Assistance Fund on behalf of the AWLFI, we ourselves continue to do our bit in the fight against cancer. In partnership with the Committee on Women and Gender Equality and the Casuso Foundation of East Avenue Medical Center, we are offering free mammogram services so that high-risk patients need not back away from this very basic diagnostic service due to the expense involved. You heard it right. We are offering it for free to every woman with a doctor's prescription all year round, as we are committed to funding this public service. We are just steps away, and we shall put up notices indicating the phone numbers to call. The Association of Women Legislators Foundation Incorporated does it bit in partnership with members of the civil society. In the pink October of 2022, around 150 house staff and employees were given free breast and cervical screening after a seminar on breast and cervix health in partnership with Surreptitious International of Ortigas and the Environs, Philippine Cancer Society, and the assistance of the Committee on Women and Gender Equality, HREP God Focal Point, and HREP Medical and Dental Services. Furthermore, AWLFI makes it a point to donate annually to the Philippine General Hospital's Pediatric Cancer Ward, which we even included a Christmas treat last year for them. Cancer is no respecter of gender or age, but the lack of treatment is felt most severely by the economically vulnerable. Hence, my appeal. It need not be a death sentence, but the word needs to get out on where and how affordable treatment may be had through active cancer awareness promotion, prevention, screening, treatment, and even palliative care. Your Honor and esteemed colleagues, let us increase the Cancer Assistance Fund to 2.3 billion pesos in 2024 for the sake of at least 14,000 more lives. More than patients, they are persons treasured by their families. Let us give them a fighting chance to fight the good fight and triumph over cancer. Mr. Speaker, thank you and good evening.
Majority Leader.
Mr. Speaker, I move that we refer the speech of the Honorable Representative Linabelle Ruth Villarica to be referred to the Committee on Rules for its appropriate action.
Is there any objection? Chair hears none. Motion is approved.